Hi everybody, my name is Dr. Heather Moore, owner of Total Performance Physical Therapy. Let's talk about getting relief when you're trying to sleep on your side. So most of us are completely married to the side that we sleep on, or the back or the stomach. Very hard to get anybody to change sleeping positions, but when something hurts, it really makes it difficult to sleep, and you wind up tossing and turning and actually making a lot of other things hurt a lot worse. So making sure that you're in a comfortable position to fall asleep in is of utmost importance. And most people are really, they really want to sleep on the side that they are used to sleeping on, but when you have hip pain, it can be tough. So let's talk about where that hip pain comes from. Well, there's a couple reasons why your hip can hurt. So there's this bone right out here. Kind of run your fingers along, you're going to feel a bone out here, and this is really a pressure point. Even if you have a lot of extra padding like I do on your hips, it does tend to still compress, and really you can feel that pressure point when you lay on your side, depending on the age of your mattress, what type of mattress you have. This point right here can cause a lot of pain, and this could be because of some what we call bursitis, whether there's some inflammation around that joint area. It could be due to tight muscles. So there's some varying degrees of what is causing this pain when you are on your side. It could also be this large muscle group here, this IT band, going into what we call the tensor fasciae lata. That being tight can cause you pain when you're sleeping on your side, and can cause that pain in the hip. So two kind of things that are going to be, we're going to discuss how we really work on those things in order to relieve your pain when you're sleeping on your side. So I'm going to give you a couple of suggestions on how you can position yourself so you aren't that uncomfortable, but also things that you need to do when you wake up to really relieve this pressure. So one of the things that you're going to want to work on is you're going to want to work on actually relieving this muscle here, this IT band, and this muscle in your butt of a lot of the tension, a lot of the knots that are in there. So if you go to our YouTube channel, Total Performance Physical Therapy, you'll see a lot of foam rolling on lower legs, on piriformis, on the IT band. Those are what you want to concentrate on when you're working on relieving this muscle tension in through here. Another great stretch to do is this figure 4 stretch that I've shown in other videos. Again, reference our Total Performance Physical Therapy YouTube channel. But quick refresher, you can sit up nice and straight and lean forward. This is going to get this hip and glute area stretched out to relieve some of that pressure. So what can you do just to get relief in the moment? So a couple things you can do. You're going to lay on your side. I'm going to pretend like we're going to sleep here. You're going to lay on your side. Now, one of the things that you can immediately do is stack some pillows behind you. All right, so you just kind of roll off of that hip a little bit. It's still side sleeping, all right? So you're still on your side, but you're taking that direct pressure off your hip, and you want to have pillows behind you supporting you so you're a little bit more comfortable. So you're able to kind of feel that support behind you. Most people, when you're laying on your side, if you try and roll off and don't have pillows behind you, you're going to feel like you're falling. You're just not going to be able to be comfortable. You're going to feel like you're in limbo. That's certainly not what we want. So stack, this is a pretty flat pillow, so you may need some, multiple pillows to stack up behind you in order to feel supported. The next thing you can do to relieve hip pain, and it's something that even if you don't have hip pain and you aren't doing, you want to put a pillow between your knees. So when you lay down, you're situated like this, and that's because you want to keep your hips in line with your ankles and your feet and your back. Okay, so having proper position, if you're not using a pillow, as you can see, my hips really pull the entire low back this way, okay? The legs are dropped, they're going in, everything's really out of alignment. And what that means is my body has to work a little bit harder in order to be able to balance everything out. Well, with this pillow in between your knees, and you don't have to have a fancy leg pillow, it can just be this, you're able to bring that into level, and that's how you're going to help that hip pain. Not this, where you're pulling on that hip all night, you're pulling on those muscles. And even though it doesn't feel like you are, that's exactly what's happening, is everything's elongating when you are in that position, as opposed to this nice position where everything is in